The following portion of Daytime is sponsored by Florida Cancer Specialists and Research Institute.
During Colorectal Cancer Awareness Month, health experts are reminding us all about the importance of early detection and screening for colorectal cancer. Here to share the warning signs and the latest treatment options is Dr. Richard McDonough. He is the Director of Patient Advocacy for Florida Cancer Specialists and Research Institute. Doctor, welcome. How are you?
I'm good. Thank you so much.
So just how common is colorectal cancer in this country, and who's most at risk?
So everyone is. So both men and women. It actually is the third most common cancer for both men and women. And about 150,000 people per year will be diagnosed with this.
And so of those people, when they're treated, how successful in general is colorectal cancer treatment?
So treatment successes continue to improve, and it varies by how early the disease is caught. So to your point earlier, the screening becomes so important because if you catch the disease early, the screening gets you to a point that you can have a better and more successful outcome.
When should you begin screening?
So age 45 for the average person. If you have a family history or if you have any genetic history that would be important to be screened earlier, or certainly symptoms that are concerning, then you would want to get seen sooner.
If you get the diagnosis, what are the latest treatment options out there right now?
So beyond the key approaches to surgery, so minimally invasive surgeries have really taken over for the best way to approach that. When you need additional treatment past that, we have many different types of chemotherapies, but the newest treatments are actually immune therapies that are focused on certain abnormalities in the cancers to be able to enhance the ability to knock that cancer out. Beyond that, we've got targeted treatments that, depending upon the genetic component of the cancer, might be your best option to have the best outcome.
So you mentioned the importance of early detection. What are the signs to look out for?
So important things, there are certainly any bleeding. So whether that's dark stools or whether that's red blood in the stool, that should not be ignored. If you have changes in your bowel habits or certainly abdominal pain, that's something as well that would be important.
And so what should you do if you notice any of those symptoms? What's the first thing to do? Because some people might think, well, I'll wait it out. I don't know if I qualify for the type of person who should go to a doctor about this.
The key is really to reach out to your doctor. So that could be your primary care doctor, that could be gastroenterologist. If you're already seeing an oncologist or hematologist, absolutely communicate that to them so that they can connect you to the important people.
Does family history play into this form of cancer like it does others?
It does. So there's some increased risk for family history, and there are certain genetic syndromes that have markedly increased risk.
So does that change the guidelines for screening?
Excellent question. So yes, if you have that history, you would like to get screened 10 years before the age of the first cancer that's happened in your family.
Okay.
If you have a genetic condition, there are pretty specific guidelines to tell you what age you should start that screening.
And Florida Cancer Specialists, is it comprehensive from diagnosis to treatment all the way through?
We can connect you to all the different parts of that,
Okay.
and we have an elaborate research system that we can get some of the latest clinical trials and dozens of trials across each year to be able to get the very latest treatment options.
A great resource. Thank you so much, Doctor.
Thank you.
You're welcome. And if you'd like more information, visit flcancer.com. Daytime will be right back.
The preceding portion of Daytime was sponsored by Florida Cancer Specialists and Research Institute.